How to care for your mouth during active chemotherapy treatment. Your chemotherapy schedule is designed for you. Your treatment may occur over many months with pauses in between. Even though you do not come in for your treatment every day, your chemotherapy continues to work on your body. It is important that you follow the instructions given by your primary care team throughout your entire treatment journey. Your registered dietitian will help you with your eating and drinking. If you are having trouble eating or keeping your weight the same, tell your primary care team right away. It's important to make good food and drink choices while on active chemotherapy treatment. Follow these guidelines for best results. Choose high-protein, high-calorie foods and fluids such as cheese, milk, meat, eggs, beans, Greek yogurt, puddings, and ice cream. Choose soft or blended foods if you are having pain or trouble chewing or swallowing regular foods. You can add sauces, gravies, oils, or butter to help moisten your food. Avoid acidic foods and fluids like tomatoes and orange or grapefruit juice. Avoid dry, hard, crusty foods like toast, nuts, chips, and raw fruits and vegetables. Eat many small meals or snacks during the day when eating becomes more difficult. Take nutrition supplements and/or smoothies or milkshakes. Aim to drink 8 cups of non-carbonated, alcohol and caffeine-free fluid every day. Take small bites of food and sips of fluid often to keep your swallowing working. While in active chemotherapy treatment, it's normal for your taste to change. Ask your registered dietitian or primary care team for tips to help make food taste better. At any time during treatment, you may find that swallowing is more difficult due to the treatment side effects. Your mouth may feel dry, so you should carry a bottle of water with you and sip often. You may also notice changes to your taste and sense of smell. Talk to your healthcare professional if your mouth or throat feels like it is on fire when you swallow. Your primary care team will help you with your mouth care during treatment. Follow these dental care techniques while on active chemotherapy treatment. Floss at least once daily if you are able. When brushing, use a soft toothbrush with a fluoride toothpaste twice daily to avoid tooth decay. Gently brush after meals and before bed. If you cannot bear toothpaste, use bland mouth rinse recipe. Clean your mouth with a moist gauze or foam swab soaked in mouth rinse if your mouth gets too sore to brush. Even if your mouth is sore, you should continue with your oral care. You may rinse with a topical anesthetic rinse as prescribed by your dentist or oncologist. When rinsing, rinse, swish, and spit rinse several times after brushing, flossing, and eating. Rinse every 1 to 2 hours while you are awake. For thick mucus, use mouth rinse more often and sip water. The following is a recipe for bland mouth rinse: 1 teaspoon of salt, 1 teaspoon of baking soda, and 4 cups of water. Mix 1 teaspoon of baking soda and 1 teaspoon of salt with 4 cups of water. Put the mouthwash in a container with a lid. The mouthwash should be kept at room temperature. Discard at the end of each day and make a new batch. To use the mouth rinse, shake well before using. Rinse and gargle with 1 tablespoon and then spit out. Repeat 2 or 3 times at each use and use mouthwash every 2 hours during the day. If you have dentures, keep them out as much as possible. Remove your dentures, plates, and prostheses before brushing. Brush and rinse dentures after meals and before bed, and soak them in cleansing solution for at least 8 hours. If you are on antifungal therapy, soak in antifungal solution. Moisturize nasal passages through the night with a steam vaporizer in your room. Moisturize with mouth rinse and water-based lubricants often. Avoid petroleum jelly and glycerin products. To care for your lips, use water-soluble animal or plant-based oil lubricants often. Do not apply petroleum jelly. If you are scheduled for dental care, inform your dentist that you are on active cancer treatment. The dentist should contact your primary care team before proceeding. It's important to pay attention to your health while in chemotherapy treatment. Tell your healthcare team right away if any of the following occur. You develop mouth sores, you feel pain when you swallow, your mouth feels swollen, or you feel pain that affects your eating and drinking. If you develop a fever of 38 degrees Celsius, 100.4 Fahrenheit or more, seek medical attention at your local emergency department.